Introduction. As we age, oral health problems gradually emerge, and our teeth, irreplaceable as they are, play a crucial role in chewing, speech, and even the confidence we feel when we smile. A complete, evenly aligned set of teeth not only makes it easier to thoroughly chew food and ease the workload on the digestive system, thereby enhancing nutrient absorption, but it also helps to keep our facial appearance vibrant. However, as time goes by, a range of dental issues occurs frequently among older adults. These problems not only affect eating and speaking but also make proper oral care more essential than ever. This guide will explain the common dental diseases seen in the elderly, discuss their underlying mechanisms, and outline effective prevention and treatment strategies. By following the recommendations provided, you can build a comprehensive oral care plan to delay tooth deterioration and maintain a healthy, confident smile. The structure and function of teeth. Teeth are composed of three main parts: the crown, the neck, and the root. The crown, which is visible above the gum line, is primarily responsible for chewing. The root, embedded in the alveolar bone, provides the structural support necessary to keep the tooth firmly in place. The neck connects the crown to the root and serves as a transition zone between the tooth and the surrounding tissues. The outer surface of the crown is covered by a very hard layer called enamel, while beneath it lies dentin and cementum, which contain a high percentage of inorganic material with relatively little organic substance and water. Inside, the pulp houses a rich network of blood vessels and nerves that transmit sensations such as pain when the tooth is irritated. Because the complex and delicate structure of teeth makes natural healing difficult once damage occurs, it is particularly important for older adults to take good care of their dental health to prevent problems from developing. Common oral diseases in the elderly. Gingivitis and periodontitis. Gingivitis is an inflammatory condition caused by the buildup of oral bacteria along the gum line. Early symptoms include red, swollen gums and bleeding during brushing. If left untreated, this inflammation can spread deeper, damaging the periodontal ligament and alveolar bone and eventually progressing into periodontitis. At this stage, teeth may begin to loosen, gaps between them widen, and eventually some teeth may even fall out, much like a house with a weakened foundation. For example, 50-year-old Mrs. Anderson neglected her oral hygiene for years. Her gums would bleed and become puffy frequently. Eventually, she was diagnosed with moderate periodontitis. Although dental treatment relieved some of her symptoms, a few of her teeth had already become loose, interfering with her ability to eat and speak clearly. Dental caries, tooth decay. Dental caries are areas of tooth decay that result from acids produced by bacteria that metabolize sugars. With modern diets high in sugar and carbohydrates, and diminished saliva production in older age, the risk of cavities increases. Once a cavity forms, it not only weakens the tooth structure but can also lead to more severe infections such as pulpitis or periapical periodontitis if bacteria manage to penetrate deeper into the tooth. For instance, Mr. Johnson, a 75-year-old man, experienced multiple cavities due to poor oral hygiene and frequent consumption of sweet foods. Ultimately, he required several fillings and root canal treatments, and his quality of life was significantly affected by the discomfort and expense of the treatments. Pulpitis and periapical periodontitis. When dental caries extend deep enough to invade the tooth's pulp, they can trigger pulpitis, an inflammation of the pulp tissue. If left untreated, the infection may spread further to the area around the root tip, causing periapical periodontitis. Patients with these conditions often suffer from severe tooth pain, a heightened sensitivity to hot and cold temperatures, and sometimes even face swelling in the face and fever due to the systemic effects of the infection. For example, 67-year-old Mr. Williams ignored a small cavity which eventually evolved into pulpitis and then periapical periodontitis. He experienced excruciating pain and sensitivity, which forced him to undergo multiple root canal procedures. Excessive tooth wear. Unhealthy chewing habits, uneven biting forces, and habitual consumption of very hard foods can lead to excessive wear on the tooth surface. When the enamel wears away, the underlying dentin becomes exposed, causing increased sensitivity to temperature changes. In more severe cases, this wear may progress to pulpitis or even result in micro cracks that eventually cause the tooth to fracture. One elderly gentleman, for instance, had a particular habit of chewing hard nuts on one side of his mouth. Over time, the uneven wear led to persistent tooth sensitivity that disrupted his eating routine and even interfered with his sleep. Tooth loss and missing teeth. The loss of one or more teeth is common among older adults. Tooth loss can occur as a consequence of advanced periodontitis, untreated decay, or even trauma. Missing teeth not only diminish chewing efficiency but can also lead to shifting of the remaining teeth and loss of normal dental alignment, which in turn affects facial aesthetics and speech. Prompt prosthodontic treatment, whether through removable dentures, fixed bridges, or dental implants, can help restore function and preserve the integrity of the dental arches. For example, Mrs. Davis, who was 72 years old, gradually lost several molars due to untreated periodontitis. Because she delayed dental restoration, the neighboring teeth shifted, and her bite was further compromised. Ultimately, she opted for dental implants to restore both function and her smile's attractiveness. Wedge-shaped lesions. Many seniors develop wedge-shaped defects at the necks of their teeth due to improper brushing techniques, particularly those who habitually use a horizontal brushing motion. These lesions, which appear as narrow grooves near the gum line, not only lead to sensitivity, especially when eating or drinking, but can also serve as a gateway for bacteria to enter and cause further complications like pulpitis or periapical infections. A 70-year-old man described experiencing a dull sensitivity along the gum line every time he brushed his teeth. Upon examination, his dentist observed clear wedge-shaped notches on several teeth. After receiving proper oral hygiene counseling and switching to a gentle, vertical brushing technique along with a desensitizing toothpaste, his discomfort significantly decreased. Prevention and treatment strategies. Maintaining good oral health is the foundation for preventing dental diseases. With consistent daily care and regular dental checkups, most oral health issues can be detected early, managed effectively, or even entirely prevented. Below are several key strategies. Establish good oral hygiene habits. Brushing properly. Brush at least twice a day for a minimum of 3 minutes each time, ensuring every surface of each tooth is cleaned thoroughly. Use a fluoride toothpaste, which helps to strengthen enamel and prevent decay. Flossing or using interdental brushes. Gently clean between the teeth with dental floss or an interdental brush to remove food particles and plaque, particularly in areas that a toothbrush cannot reach. Regular replacement of your toothbrush. Change your toothbrush at least once every 2 to 3 months or sooner if the bristles become worn. This ensures that you always have a tool capable of effective cleaning. Schedule regular professional dental examinations. It is recommended that older adults visit a dental professional every 3 to 6 months for a comprehensive checkup. Early identification and treatment of issues such as gingivitis, periodontitis, cavities, or wedge-shaped lesions can prevent minor problems from escalating into major health concerns. Depending on the diagnosis, treatments may range from professional cleaning and fillings to root canal therapy or surgical interventions for more advanced cases. Adopt a balanced diet and supplement nutrients as needed. Adequate nutrition is essential for maintaining robust teeth and gums. Incorporate foods rich in calcium, phosphorus, and vitamins C and D, found in dairy products, leafy greens, and fruits, to fortify your dental structure. At the same time, minimize the consumption of sugary beverages and snacks, as they feed decay-causing bacteria. Remember, adequate water intake not only helps maintain general health but also promotes saliva production, which plays a critical role in naturally cleansing the mouth. Modify unhealthy oral habits. Correcting detrimental habits can prevent further damage. This includes using proper brushing techniques. Avoid aggressive or horizontal brushing that can cause trauma to the gum line. Quitting smoking. Smoking adversely affects gum health and significantly increases the risk of periodontal disease. Avoiding hard chewing habits. Refrain from chewing excessively hard foods and objects, as they can accelerate tooth wear. In cases where significant wear or missing teeth have already occurred, consult your dentist about restorative options such as crowns, veneers, or dentures to improve both function and appearance. Utilize specialized oral care products in addition to regular brushing and flossing. Consider incorporating specialized products like antimicrobial mouth rinses, dental floss picks, or interdental brushes to further reduce bacterial buildup and prevent tartar formation. For seniors prone to dry mouth, using moisturizing oral sprays or saliva substitutes can be particularly beneficial, as sufficient saliva is key to maintaining oral hygiene and preventing decay. Conclusion: the state of oral health in older adults is intricately linked with overall well-being. Dental issues such as gum disease, cavities, and excessive tooth wear not only compromise the ability to chew and speak but can also lead to more severe systemic health complications if left unchecked. By embracing good oral hygiene habits, scheduling regular dental visits, eating a nutritious balanced diet, rectifying harmful habits, and incorporating professional care products into your daily routine, you can greatly reduce the risk of developing significant dental problems. Taking charge of your oral health today will ensure that you continue to enjoy the pleasures of eating, speaking confidently, and smiling vibrantly for years to come. Remember, prevention is always better and less costly than cure. Start with small, consistent steps towards a healthier mouth and a brighter smile. Whether it's the early intervention for gum recession or a timely filling to stop a cavity from worsening, every effort invested in your dental care counts. May every older adult prioritize their dental wellness, maintain a routine of regular checkups, and make informed, proactive choices that steer them toward a lifetime of healthy teeth and a confident, radiant smile. Important reminder: always consult with a qualified dental professional for personalized advice and treatment options before making any significant changes to your oral care regimen. The guidelines provided here should be tailored to your individual needs and health conditions, and professional evaluation is indispensable to effective dental care.